Hi and welcome back to another video of Medic Notes. This video is on counseling on hormone replacement therapy. There are 10 main steps to take note. First, we introduce ourselves to the patient. Confirm the patient's ID and details. Check their background knowledge on HRT, see how much they know about it. Explain what HRT is. Hormone replacement therapy is a medication that contains female hormones. You take the medication to replace the estrogen that your body stops producing after menopause. There are a few types of HRT, such as pills, skin patch, gel, and cream. The indications of HRT are post-hysterectomy, or severe menopausal symptoms. Complications. Progestogen might cause acne or weight gain, whereas estrogen might increase risk of breast cancer and thromboembolism. Side effects of HRT. For the first few weeks after commencement of therapy, the patient may have nausea or breast discomfort, but these symptoms usually resolve after a few months. Skin patch may also cause skin irritation. The benefits of HRT are relief of symptoms like hot flush, mood swing, vaginal dryness, and protection against osteoporosis. For monitoring and follow-up after therapy, investigation like mammogram is done 2 yearly. Follow-up 6 months after HRT. Lastly, before ending, ask patients if they have any more questions. That's all for this video. Thank you.